Hello, my name is Lori and I'll be demonstrating how to perform a capillary dermal puncture. Okay, the first step in performing the procedure is introducing yourself to your patient. Hello, my name is Lori. I'm here from the lab. I'm here to collect some blood. The doctor ordered some lab work. Can you please verify your name and date of birth for me?
Juan Tiscareño, 11/4/91.
Okay, patient's information matches my requisition. He already gave me consent in proceeding with the procedure. First of all, I'll be collecting my equipment. This is what I'll be using. First, of course, my gloves. I'll be using my lancet, a band-aid, alcohol pads, cotton ball, and of course my micro collection tubes. After I've collected my equipment, I'm gonna go ahead and proceed with my hand washing. I already did my hand washing. I'm gonna go ahead and apply my gloves. Once you have your gloves on, you go ahead and ask your patient for the hand, their non-dominant hand. Sir, can I please borrow your hand? Okay, since he gave me consent, I'm going to go ahead and continue with the procedure. For an adult, you want to do a dermal and capillary puncture in their fourth finger, which will be their ring finger. In infants, if the doctor orders a dermal capillary puncture, you will be using their heel. But in this case, since it's an adult, I'll be using the ring finger. First, you want to go ahead and milk the finger. Don't milk it excessively because you don't want to get that interstitial fluid in the blood. You just want to milk it a little bit. Once you milk it a little bit, you want to go ahead and proceed to getting your alcohol pad. You clean the site. And in the dermal puncture, you always do it on the side. You don't want to do it right in the center of the finger. You let it air dry. Once it's air dry, you remove the cap of your lancet. And when you're going to do the incision, you go ahead and apply pressure on the finger. Make sure you put enough pressure on the lancet so you could make a pretty deep incision so you could get that blood flow faster. So you apply pressure, and here we go. The first drop of blood, you swipe it. You always make sure you swipe it. You get your micro collection tube. You don't wanna touch the skin. You just get make a drop of blood in the finger, and blood will start flowing in the tube, just like this. You might want to tap it a little bit so you could get that blood flowing down in the tube. If you see blood squirting down, you just want to clean it and try to get another drop of blood. If you feel you're uncomfortable, ask your patient to move the arm sideways. Like I said, you want to tap it in a hard surface so you could get that blood flowing. Once you've collected a tube, you want to remove the top part, close your tube, your micro collection tube, and invert it. Depending on how many tubes the doctor ordered or how many tests, that's how many tubes you'll be collecting. In this case, the doctor just ordered one lab test. You want to ask your patient to apply pressure on the finger. Can you please apply pressure, sir? Thank you. You want to label, dispose of your lancet and your tube, and then you want to check on your patient to see if he's still bleeding or she's still bleeding. If he is, you want to clean it and apply a band-aid. Okay, the last step would be labeling your specimen. You want to label the specimen in front of your patient. You want to put patient's name, last name, first name, date of birth, date of service, date of when blood was collected, and your initials. Once you're done with this, you want to go ahead and put your specimen in your biohazard bag with your perquisition, and thank the patient for allowing us to do the procedure. Thank you, sir. This will be it for today. You may leave. And that's how you perform a capillary dermal puncture. Thank you.